All right, we're going to pick up where we left off regarding muscle strength and how that is the ability of the tissue to produce tension and a force based on demands placed upon it. So strength is the measurable force that can be exerted by a muscle or a muscle group during a single maximum effort. So this is our manual muscle testing. So we can measure strength using these three different tools. So one is the manual muscle test. We can figure out the maximum load that someone can lift in one repetition. And then the other one is an isokinetic measurement, which uses special equipment that I'll show you a picture of later on in the presentations, but there's also one in your textbook as well. The one that's most commonly used, obviously, because it's the easiest, is the manual muscle test. The next couple of slides are going to go over some factors that influence muscle tension capacity. So be sure to take a moment and look at the content from these slides and make sure that you understand what we're talking about. And if you don't, then that would be a good thing to bring up during our discussions later this week. During strengthening, we want to be sure that we are giving our patients enough time in between sets to replenish these energy stores. So if we're doing a lot of high intensity strength training, we want to be sure to give the individual about 3 to 4 minutes to recover. So these are some strategies on how we can improve strength, and we're going to talk about specific strengthening exercises later on. They are also referenced in your textbook, so be sure that you're taking a look at that as well. How we strengthen and how to best achieve an improvement in strength is obviously affected by the load put upon it. So this is taking into consideration a particular exercise principle. So make sure that you are familiar with that and what that principle is. Here is a list of types of strengthening exercises that we can do. This slide here is the picture of the isokinetic machine. So you can see that it's pretty cumbersome, quite large, requires a lot of time for setup, and it is not cheap. So not a lot of places have one of these. There was only one clinic that I've ever worked at that had an isokinetic machine, and we used it a lot for patients after knee surgery. And it just took a lot of time to switch setup for different extremities. So it was kind of always left at being able to strengthen the knee. So that's where it was kept. So you don't really see this too much. But the other types of exercises that we talked about earlier with the different types of contractions and then the different types of resistance, we're going to talk about different modes of resistance, whether it's going to be manual or mechanical, and then stabilization exercises, and then implement the theories behind periodization. We need to take into consideration the parameters regarding strengthening. So you want to be sure if you're giving a strength exercise, so if we were to be having a practical, and I'd be asking you to give a patient a strength exercise, these are the parameters that you would have to provide your patient. Intensity, meaning how much weight are they going to use, what color TheraBand, body weight, closed chain, open chain, etc. Duration, how many repetitions they would do, and then frequency, the number of sets that they would do, if they would do that more than once a day, 2 or 3 times a week. Those are the parameters that you need to be sure that you're giving a patient. So the key elements for strengthening is it's high intensity, low repetitions. And this is going to differentiate strengthening from endurance exercises that is coming up shortly. When we're talking about muscle power, we're putting in the variable of rate. So we're looking at time. So how fast can an individual do a task, or how many types of burst activities could they do that's a little less intense. So the example that I had given a while back was that ability to get like a heavy suitcase into the trunk would be how quick they could do that, like if they needed to get out of that parking spot quick, or if it's low intensity activities but in bursts. So that's that high intensity interval training. How can we improve power is plyometric, so jump training, or that high intensity interval training, the HIIT training, but it's looking at putting in a lot of activity in a short amount of time, or less amount of rest in between reps. So here's how we can improve power. So either increase the work that's happening in the amount of time, or make the time interval shorter, that they have to do the same amount of work. Looking at endurance, so these are the components that equal muscle performance: strength, power, and endurance. Endurance exercises are low intensity exercises over a prolonged period of time. So now the variable of weight and reps is going to change. So what we want to do is we're going to have less resistance, but a lot more reps. So if you're doing endurance exercises, you should never be fewer than 20 repetitions in a set. It actually should be significantly higher than that, but for endurance, never lower than 20 repetitions. So when we're looking at muscle endurance, this is obviously going to include the use of oxygen, so it's going to be aerobic, and we want the muscle to be able to contract repeatedly against this load for an extended period of time. And so this is going to be like, we might incorporate endurance exercises for patients who would have to do a lot of repetitive movement for their job or their hobby. So we would want to make sure that we're training those muscles for more than just strength and include endurance exercises. So again, that key component of for endurance exercises is the low intensity contractions, so lighter weights, high repetitions, so again, no less than 20, and for a longer period of time with fewer rest periods in between sets. Here's some positive outcomes for endurance exercises, and these are some considerations on why we might use endurance instead of strengthening. Obviously, when we're looking at endurance, we're going to use more, we're going to have a higher increase in blood flow. We want the individual to have plenty of energy, and so there is going to be a difference in the amount of energy. You're going to be tapping into different energy systems doing an activity for a prolonged period of times. And another special consideration is that strength does not automatically equal endurance. This goes back to our specificity principle, that we're going to get what we put into it. So we have to make sure that we're providing the patient with, or the individual with, both strengthening and endurance if we're looking to enhance all of muscle performance.